Good afternoon. I put together these slides having in mind that some of you may be thinking about starting some type of program in your county. The catalyst for Collin County was the fact that we were, like your counties, have had people with mental illness in jail so long. They were spending 400% longer than the average population. And as Mr. Wishcamper told you this morning, we were seeing people who were coming back competent and becoming incompetent, and we were just doing it all again. So what we had to look at, because it was a big fight in our county to get here, and people kept saying, well, show us why we need this. And so I kind of broke it up into the impact of 4 groups. We were going to impact the judicial system, the jail, persons with mental illness, and even our local police. And one thing that's in common with every one of them was it's going to impact them financially. And we had to show them that. We knew it would improve the court process. We knew it would help with competency issues, and we knew that all of them faced these problems, and money was a big one. So in moving forward, we had to demonstrate to them how this was going to be effective. So in our county, they asked for the grant from TIDC begrudgingly, but did so by contracting me instead of setting up a department. I was more expendable on contract than as a county department. So that's how we started out. We started out with 3 people in our office, and primarily that's who still operates on the managed counsel side. So I do have 25 private practice attorneys who have to go through additional training to be on this wheel. And I can tell you that the very most important thing that this program gave us was a central point, a hub. And that matters for everybody in our system that we deal with. And I'll tell you a little bit more about that. We have a problem, and I don't know what your percentage of people with mental illness in custody in your jails is, but ours is running about 27%. And that's a lot of people, it's a lot of work that we were looking over. And as you know, with the implementation of the statute 1622, the early ID, and the 17032 bonds, that's a lot of work. And we've been trying to figure out how to handle those cases. So I added this data for you, and purposefully, so it would be in the packet that TIDC posts with the information from today, because this gives you some data to start with. And we, in 2013, 14, 15, this is our 5th year that we're finishing up, we've saved our county over $2 million in jail days alone. Just by decreasing the time people are in jail for competency and people are in jail deteriorating or not being taken care of. Because if you think about it, your people who are mentally ill are the least likely to ask for an attorney. They're the ones refusing it. So nobody's paying attention until we notice they've been there a while, and then we're addressing it. We flip that around. Those are the ones I'm looking at on day 1. When I get those notices from the sheriff that this person might have mental illness, I'm looking it up. And if they refused an attorney, I'm going back out and checking on it. And if it need be, we're overriding it and appointing counsel if it's necessary. So we're taking care of those very early on. And there's nothing that makes the jail happier than moving people out of the jail. So we have a very, very interesting relationship, I think, in our county. We've really resorted to the team approach. We have improved outcomes. Like many of my colleagues have told you, people are getting out of jail sooner, they're getting better results to their cases, attorneys are understanding it. We're having decreased time in court. We were seeing people who weren't showing up for court, so issue a warrant, rearrest. Instead, we look more at expediting cases. We look at decreasing their jail time because we're using a coordinated approach. And the bottom line is we're saving money, and that was the concern everybody had. So the jail, and I think we're very unique in that the sheriff and I are on the same page. He wants those people out. So they have given me access. They give me everything I need. We're on the same team. And we work together to accomplish the goal. Not only that, but I noticed that everyone in our community kind of operated independently. How many times have you asked somebody for information and they said to you, oh, sorry, HIPAA. We can't tell you HIPAA. Last week I had MHMR in another county that I called, and I said, hey, I need a court report on this person that the court has ordered into your program. I'm sorry, ma'am, we're gonna have to get a release from the client. I was able to quickly reply, no, sir, health and safety code, here's the statute, you don't need a release. This is new information to people because going to the health and safety code is not typical for us. We're used to the Code of Criminal Procedure and the Penal Code. So finding that has made a big difference. We've reached out to people and we've set up networking. I have somebody I can call. Collin County, for those of you who don't know, it's just north of Dallas. If I have a case that is a person in Collin and Dallas, I'm able to pick up the phone and call Dallas and say, hey, let's work together on this. They may call me and say, we would like to put this person into outpatient competency. Your county has a hold. I'll walk next door to the court, say, Judge, here's the deal. Sure, no problem, bond. And that's working together. It's because we formed those relationships and built that network, and we're saving both counties money. We're saving jail days by doing this and working together instead of doing nothing till that person gets transferred. And these are important factors in what we do. Our training also includes an annual symposium. So instead of everybody, again, worrying about HIPAA and staying in their own little shell, we decided to have an annual event. And when I say we, I mean the sheriff's office, some of the local providers. We formed a committee and we meet every month. And that's not only an opportunity to plan this training, but it's an opportunity to talk about common problems that we're having and work on solutions. So every year, the Thursday before Thanksgiving, we have our mental health symposium. The first year we had about 100 people. We expect 400 in attendance this year. Jeff Kyle's going to be our keynote speaker. That's how invested people are in working together as a community, and it makes a huge difference. Our courts have also designated our office as the liaison to the state hospitals. And again, this is what I tell you about having that one person that people can call. State hospitals love it. Your reports from the state hospital, they get faxed or mailed to the court, maybe take a couple weeks. You got 14 days to pick them up. You got a few more days till your hearing. You can quickly be a month behind. They email those to me on Friday. We have the pickup on Tuesday and court that week. And you can save days. So just working together as a team is absolutely critical in that approach. We would like to expand and move to a full managed counsel where we're looking at all of the other attorneys, not as mental health providers, but our mental health wheel attorneys, but being on our wheel too. And we've had a difficult time with that aspect because I think the courts say, well, you know, we're functioning well. These attorneys turn in their pay sheets, we call them and they show up and we manage these cases. Yes, you are managing well, but it can be better. The defense bar doesn't really have a resource in our county. And much like Mr. Wishcamper told you about Lubbock, it has been so important to develop resources for that defense bar, to bring them to the table, to let them have a voice. They have somewhere to go. They have our office. They're in trial. They can come in and research. They can have lunch. Whatever it is an option for them to use resources that we have. And a result of that is their cases are moved faster and their clients are treated better. Those are just the most important elements that we have. With the changes in the legislation for the early IDs and the expediting those sooner, we expect to see more mental health bonds. Our county has used the mental health bond statute 17032 since we started. And every week, twice a week, we have mental health bond hearings. We now expect to do it on a daily basis at magistration and move those clients faster. My greatest fear when this legislation changed was that these people would be moved out too quickly. And that's the problem we faced initially. When they were released, we said, bye, see you, make an appointment. And they didn't have the services they needed. So we also have our case manager who makes those appointments for them. And we make sure that they're released with medication. Somebody's driving them over to the pharmacy to pick up medication for 30 days to get in. We work with our local MHMR to help provide those services in jail diversion. And they're an active partner in what we do. I meet daily, weekly, with our medical provider. And we review those high priority cases that need something. And one of the other interesting things that we found, I don't know how many of you are familiar with CIT, Crisis Intervention Teams. Those are trainings for law enforcement in our communities, but they also involved our people in the community that are involved with mental illness. So I started teaching at those trainings, and the benefit for me of doing so was those officers know me now. We kind of broke down some of the barriers of defense. And I frequently get calls from them, and they say, I have this case, I don't know what to do. We've arrested him 100 times. I don't know what to do. What can you help us with? And we can help and try to address that. I'm also able to call them. I know earlier we heard about the timely filing of cases. Well, we don't have cases filed very timely in our county. Sometimes it's a year, sometimes it's longer. So when I have somebody who's very ill that just needs that case moved one way or the other, I can call that police department. I have a contact, and I can say, can you help us out? Either file it or drop it. And they help me, and they address my needs because I'm there to help them too. And I think that's what's most important about what we've done is really developing these partnerships of cooperative effort to move forward instead of just being on our own and trying to succeed with this, just operating with what we have, the 3 people. So it's a very important part. And like Jordan said, I have a bad habit of giving everybody my phone number and my email. So, please let us help you if you're even thinking about this type of service. We were fortunate that everybody's been great to help us. I've visited, I can't tell you how many counties, Judge Wood, I saw Judge Wood here, and I visited them in Montgomery County. I visited Travis, I visited Bear, and I asked them, about their programs. I learned what they did and what would best work for us. And I think you've seen from everybody talking today, we're all kind of a hybrid. There's not one of us that's the same. We have to find what works for our county. And I would encourage you to make those visits, make those trips, ask for their data. We all have data, and we're all happy to share it. And I know TIDC's put together a kind of a 101 book, and I think we're all there to help you, and it's a great solution for the people with mental illness, especially in your system. Thank you.